Achieving best results with limited grafts. Achieving excellent hair transplant results isn't always about using a large number of grafts. It's about using them wisely. With a strategic planning, precise execution, a uniform distribution can give you a thoughtful hairline design would always give you an illusion of natural hair transplant and even long-term donor safety. About this case, usually each patient is different for a surgeon, and this patient usually represents almost class 4 or class 5 type of baldness, where we need actually hair to be implanted in the hairline area and crown area also. Well, patient also wanted to get some grafts done in the temple angles. That's the kind of we are inviting more baldness. Well, same time, this patient had options of getting it done 2 days procedure or 2 sessions with a gap of 6 months. But he opted for only one procedure, around 3,500 to 3,600 grafts, and expecting to get complete coverage. During discussion part and consultation and during the surgery, it happened to advise him such a way that it's not a wise idea to implant everywhere because the number of the grafts required for such case is more than 5,000 to 6,000. But there is a limit for doing only 3,500 to 4,000 in a day. It happened to advise him such a way that we're going to do hairline area and mid scalp, certain part of the crown, not completely crown. So even implanting some grafts, very few grafts in the temple angles. So he accepts for that because he had a time constraint factor, even budget constraint factor, where he would not come back for second session. We are not sure of it. So in such type of cases, we should be very careful about designing a hairline. A thoughtful hairline always makes you kind of a good illusion, which is going to give you a natural look for you. And also you're going to save the donor for the future. Precise execution, if you can follow in hair transplantation with the wise usage of the grafts, even limited number of the grafts can get you a very decent outcome and naturalness to the hairline. So that's what we did for this patient. We harvested approximately 3,650 grafts. We implanted more in the hairline, mid-scalp, and half of the crown area, and also few single follicular units for the temple angle. Actually, in such scenarios, we should not implant in temple angles because we're going to need more grafts. Basically, there's a shortage of the grafts because of many other factors in this patient. But well, we could execute that way. So with great difficulty, even patient understood the kind of scenario we're going to follow in his case, because I already discussed many times, each patient has a different question paper. Each patient has a different scenario. We can't execute the same plan. So how wisely we are going to use these grafts, precise artistic work would definitely give you kind of a natural illusion and density to your transplantation, which is the most important factor. That's what we did for him. After 8-9 months, you can see the astonishing results. That's a very natural hairline and thick density in the mid-scalp. Even part of the crown has been implanted, as we discussed earlier, which gave him a kind of a fullness. And probably you would need second session later in the future if you lose more hair, or if you really want to reinforce some density in the crown area, you can think about doing so. So as of now, we did only one session to achieve such kind of results. Well, kindly note, it may not be possible in all the patients. Here there are a few advantages where he had a very thick donor and each follicular unit had 2-3 follicles in it. And also scalp size is a medium. So if the scalp size was a very big, probably this plan wouldn't work out for him, where he would need a second session guaranteed. So these are the factors to be considered before doing a transplantation to achieve best benefit, best outcome in the results. Most of the cases, hair transplantation results depends on not only number of the grafts, it also depends on kind of a surgeon's skill, like artistic distribution of the grafts, wise usage of the grafts, precise execution of the surgery would give you a naturalness to the hairline and also a full density illusion, so that for visuals you look very natural. That's the main goal of the transplantation. Actually, one should follow. So that is the reason it's always better to choose a best surgeon who has artistic and aesthetic sense in doing such surgeries. Thank you.